the safe management of dead bodies in the context of COVID-19. And I know that this is a session that everyone is looking forward to. So I was, just to start with, I was looking at some researches that had happened, and I wanted to see, you know, what were the psychological impacts on families when their relatives die due to COVID-19. And one of the latest studies, which was done and it was published on the 15th of May, 2021, had come to a conclusion that, you know, the relatives of families that die with COVID-19, they have a lot of psychological impacts on the family. There's distress, there's, you know, they face stigmatization, there's emotional shock. And I hope that at the end of this session, we'll be able to change our views. It's not only us discussing, okay, how are we going to handle a deceased in the context of COVID-19, but we need to think of the families as well. And we need to think of the dignity of an individual when that person passes away. So this SOP has recently been endorsed. This is the second version of the SOP that was revised by the Infection Prevention Control Cell, and also with the pediatric team. And we had some inputs from our health inspectors and the police who were involved in looking at the SOP on burial. So we've actually combined that into one, and that's what we're going to be sharing this afternoon. Next slide, Margaret, please. So Margaret will be sharing with us on the next few slides before I finish off with the SOP this evening. Over to you, Margaret. Thank you.
Thank you, Sarema. I think there's still some people on with their microphones on, so please keep yourselves on mute while we are presenting, so that everyone can hear the presentation. Thank you. So this is the introduction section of the SOP. So the presentation is purely extracted, if you like, from the updated version of the SOP that was developed last year in 2020. Now, you know, with the increasing number of COVID deaths occurring now, as we all know, at home and at hospital, there is a need for us to ensure that bereaved families are able to perform and accord their departed ones the final funeral rites in a dignified and a COVID-safe manner, which is important. And, you know, as we go through this high peak period of COVID cases, and as we wait and go through this gap towards, you know, having our target population fully vaccinated, it is the deaths that occur during the infectious stage of the disease that are likely to be an ongoing concern. So this guidance is aimed to ensure that the care of the deceased person is performed safely and respectfully for all involved. The main aim here is still to ensure that we are able to provide a safe and dignified and a compassionate approach to end of life. In terms of the purpose, now the SOP, which you should get a copy of. So there's a section on the purpose. So the main purpose is to ensure that we maintain dignity of the deceased and their cultural and ensure that you know, there are necessary steps in environmental cleaning and disinfection of the mortuary surfaces following the removal of the deceased. And also this guidance is to provide guidance on the management of the remains when in the mortuary. And, you know, as always, maintain the dignity of the deceased and their cultural and religious traditions. And also to take into consideration the needs of their families you know, and the families and friends of the deceased during this difficult period. So this standard operating procedure, so the scope of it, it applies to all hospital employees, all contracted employees, including public health uh, personnel, all mortuary employees. So it's essential that the mortuary uh, management staff are aware of the SOP. And also the family members need to know, the community members of the person who died, the religious group that come to the mortuary, and also those that preside over the remains, and also not forgetting the police, that also are important in this SOP. So in the SOP, it covers definitions, key definitions that we all need to be aware of. And so this section just covers, the length of it states that the length of time of the SARS-CoV-2 virus, can remain infectious in the body fluids and tissues in the deceased body. Is yet unknown. So we really don't know that, and we're still learning a lot about COVID-19. And we know for a fact that to date, there have been no documented cases of COVID-19 transmission through handling of the bodies of the deceased people. So even those who died during the infectious stage of the disease, however, as a precaution, it is very important that we wear appropriate PPE during the handling of the deceased. And so the PPE requirements, we must consider, splashes and body fluids during the movement and handling of the deceased. And also when in direct contact with the patient's clothing, all the bedding, the possessions, etc. And also very important is during the time of postmortems. So in terms of families and what this refers to in the SOP, so the families, relatives, and friends used throughout the SOP mainly refers to the people who are important to the deceased person. So meaning those that are closest to the person, in terms of the care that was provided. So that means that these people could be family members, friends, and also even healthcare workers who were very close to the deceased and the family. So the SOP highlights the very important components of training. So training is essential for mortuary, especially for mortuary attendants. So basic training in IPC for all mortuary staff who handle dead bodies in the isolation area must be trained in IPC. The even the mortuary, the ambulance, and all those who work also in the crematorium. Those who, if we must provide the information on IPC around the burial part of it, the burial, and also we must ensure that the refresher training is provided also to the staff that are involved in handling the deceased. And it's also important that we have a system to monitor that the SOP requirements are actually being followed. So the IPC training basically includes the basic measures, including hand hygiene, including the use of PPE, how to do the cleaning, environmental cleaning, and disinfection of the mortuary and all the areas that need to be disinfected. So section 5, this covers the processes that are to be followed during the care of the deceased. So before attending to a dead body, everyone should really ensure that You have the necessary supplies like hand hygiene, you have all the required PPE, you have all the cleaning and disinfection supplies that are readily available. It's also important to note that the movement and handling of the body should be kept to a minimum, okay, because we really don't want fluids to be seeping out that may cause a potential risk to people around. So also, it's important that we treat, every death on a case-by-case basis, especially taking into consideration the rights of the family and the need to also investigate the cause of death in some cases, and also the risks of exposure. So we must always ensure that personnel who interact with a body, um, these include health staff, mortuary staff, apply standard precautions. So this should be covered in the training, as I had said earlier, and which includes hand hygiene, which includes appropriate use of PPE, and also ensuring that they know how to put on and remove PPE. So this is basically a table to highlight the importance of PPE in the procedures that are mainly carried out during the handling of a body from the isolation room, right to the mortuary for storage, and also upon collection. So as you can see, the required PPE for all of these activities also include respirator mask, long sleeve gown. If you think that there is a need to wear plastic apron on top, then it should be done. Facial protection is also very, very important. So the SOP, one of the common veins or common threads throughout the SOP is the need is a need to ensure that there is respect for the deceased person, and also ensuring that the person's religious or cultural preferences are maintained or acknowledged. So also we must always ensure that the person that we treat the deceased person with dignity and respect at all times, and that the deceased person's religious and cultural preferences are acknowledged. Also, other important aspects of the SOP covers ensuring that the end of care life wishes of the deceased are also acknowledged in the care plan. And also, at this time, it's a very difficult time for the family. So compassion is stressed also in this SOP, especially with the bereaved families and friends, because at this time they also need to know information about IPC. And it's difficult also to talk about these things when they are going through this very difficult time. So these are just some of the things that really need to be stressed on. So in terms of preparing the body for transfer from this is section 5.2 of the SOP, in terms of preparing the body for transfer from the place of death. And so the place of death could be from the ward, even could be from the home of the dead on arrivals that come to the emergency departments. So in terms of the transfer of the deceased to the mortuary, from the time of death, we must, nurses, we all know about care of the deceased. We all know the importance of informing the next of kin immediately upon the death. And in this current COVID context, we know that the relatives are not present. So it's so important that, and I know that you're doing this already, but this is part of the SOP that needs to be stated, So the next of kin needs to be notified as quickly as possible. And we must, as nurses, we know how to manage the care of the dead, in terms of packing all the oral and nasal orifice to prevent leakage from the orifice. So that's part of the nursing care that we provide to the deceased. So this is not new. The body ideally should be wrapped in cloth or a sheet, and transfer should be done as soon as possible to the mortuary. As soon as all the paperwork is carried out at the ward level, the transfer to the mortuary should be done as soon as possible. There is no need to disinfect the body before the transfer to the mortuary area. Body bags are also not necessary, so this needs to be addressed if that's a demand. Because in this time, if there are no body bags, then it's going to be very difficult. However, in cases whereby you have excessive body fluid leakage, then this is a time that it may be necessary. But I just want to stress that body bags are not necessary. We must ensure a clear route to the mortuary is always ensured before you transfer the body across. Um, and also, it's important to note that you are still responsible to ensure the family receives the belonging of the deceased. So all non-clothing items should be handled with gloves and cleaned with detergent and disinfectant. Either you use alcohol-based alcohol 70% or diluted bleach of 0.1%. Also, the clothing item should be bagged, and also it should be handled with gloves as usual, and it should be wiped. So the garbage bag that you place it in, or any bag, should be wiped with either 70% alcohol or 0.1% sodium hypochlorite. In terms of the transfer, if you're using a vehicle, then as usual, it needs to be cleaned and disinfected as well. And also, don't forget that the trolleys must also be used in case you're using trolleys to transport the body to the mortuary. So yeah, I've just covered that as well. And so this is my last slide before Sarima takes over. So I just want to stress the importance of terminal cleaning here. This is covered under section 5.3 in the SOP. So terminal cleaning of the place of death is so important. And the main purpose is to decrease or eliminate the virus from the ward, if you like, or from the area. So the whole area that needs to be clean includes the whole patient zone, and also all the area around where the patient was admitted. Yeah, and the main idea for the main purpose of terminal cleaning is to ensure that you eliminate all the COVID virus so that you prevent, environmental contamination. And I think in the SOP, it is mentioned that the nurses are responsible for terminal cleaning of the surface, where the patient was. But if this is not the case, then this needs to be addressed. So not forgetting the personal items of the patient, equipment must be removed and reprocessed as well. And also not forgetting your full PPE must be used during cleaning and reprocessing of all these equipments and environmental surfaces. Thank you. I'll hand over to Sarima.
Okay, I hope everyone can hear me now. So still under section 5 on subsection 5.3.2, it talks about mortuary care. And again, like what Margaret had emphasized, that communication is a key factor. So it's not only communicating to the families that their relative or their loved one has passed away, uh, the other stakeholders also needs to be informed. So here in this case, we're talking about mortuary care, the morgue attendant, and those who are looking after the mortuary needs to be informed in advance as well about the case that's going to be in safekeeping. So I've just brought out 3 important points under 5.3.2, which we can all read there. Margaret had mentioned about it's not necessary to have body bags. However, I know that we've worked in healthcare facilities in hospitals. Shrouds, if shrouds are available, shrouds can be used on the deceased. So even a separate morgue is not required. However, a dedicated area within the morgue should be allocated for COVID-19 deaths. I've searched in the guidelines that are available. I've searched in the guidance for care of the deceased in the infection prevention control guideline for the UK government under CDC and WHO. It does not mention anything specifically to have a separate morgue for COVID-19 deaths. So having a dedicated area is just to assist the morgue attendants to identify, okay, this is where our COVID patients are kept, and this is where our non-COVID deaths are kept in the mortuary, so that appropriate care is provided when they're handling the COVID-19 deceased. So in the mortuary, healthcare workers or mortuary staff, when they're preparing the body, this is when the body is being collected possibly, or when it's going to be under safekeeping, there is a need to wear appropriate PPEs. And we're going to go to the next slide where we're going to see the appropriate PPEs that needs to be worn. And again, we also need to make sure that the families are involved on the care or on the safekeeping of the body. So if the family wishes to view the body, they should be allowed to do this, but we should not allow them to touch the body at any time, okay? And standard precautions needs to be adhered to, especially hand hygiene. And families need to be given clear instructions that they should not touch or even kiss the body. And we know that's a regular behavior that we do when a deceased or when a loved one passes away. So those are, in this slide, the previous slide, you will see the necessary PPEs that needs to be worn, and it's full PPEs. And again, in addition to subsection 5. Thank you, Margaret. We can move to the next slide. Margaret, next slide, please. Yeah. So handling of the dead body in the mortuary, again, we should ensure that dead bodies should be stored in cold chambers and maintained at approximately 4 degrees Celsius or below, and not above 4 degrees Celsius, because we all know what's going to happen to the deceased. And for the morgue attendants, they must ensure that the mortuary is kept clean at all times, and the environmental services should be cleaned. And Margaret has talked about the cleaning of the mortuary and cleaning of the place where the patient had died. And the use of hypochlorite solution is important when we're disinfecting. So something that we need to be reminded of is when we remove the body, okay? So the high touched surfaces, they need to be disinfected. The chamber doors, the handles, the floors, this should be cleaned with sodium hypochlorite of 0.1%. There's something that we've underlined in the SOP, and that's embalming. So if families are wishing to embalm their loved one, this is not recommended, because to avoid excessive manipulation of the body. And we should remember that the virus could still be alive in the respiratory system or in the lungs, and excessive manipulation of the body can pose a risk to those handling the deceased. And those are some reminders that we have there in subsection 5.3.3, children and adults over 50 years, even especially those with respiratory conditions or with comorbidities, immunosuppressed, they should not be allowed to come in direct contact with the body. Okay, that's why we've mentioned earlier, and it's always best to have someone supervising them there to ensure that this does not happen. So family members, they need to be informed about the funeral proceedings. This is very important, okay? And we should not leave this at the last minute, and it will, create more distraught on the family. It will create frustration on them. So that's why we've emphasized that communication is important in this process. Okay? So with funeral proceedings in a religious place, in the SOP, it's not recommended, but if so, numbers should be limited. And we know that in any funeral, only a maximum of 10 people or 10 persons should be there. Okay? And the ceremonies should be short, not too long. Again, because if it's too long, we are allowing more people to come in. So the shorter, the better. As I've said before, family and friends can be allowed to view the body in preparation for burial, but they should not touch or kiss the body at any time. And even if they do not come in direct contact with the deceased, they must be encouraged to wash their hands, and this should be readily available at the mortuary, or even use of hand sanitizers as part of their hand hygiene. One thing that we must remember, okay, for COVID deaths, once the casket has been closed from the mortuary, it should not be reopened. So closed casket is strictly recommended, listen, for COVID deaths or for suspected COVID deaths. For non-COVID deaths, I think we should give the privilege, as in practices, where the caskets can be opened. This is a question that's been frequently raised, so I hope that this has been clarified this evening. For positive and suspected COVID deaths, caskets, once they're closed in the mortuary, they should not be reopened. Okay? And again, another thing that we need to emphasize here, that PPE is not required for pallbearers. It is only required for those who will be handling the body at the mortuary. Okay? So once the body goes into the casket is sealed, the casket is disinfected, the PPEs are doffed. Okay? That's the last time that PPEs are worn. The only thing that we will encourage for pallbearers to use is gloves. Even gloves is not necessary. Hand hygiene is the ideal standard precaution that should be used. So I've put a bold there that unnecessary wearing of PPE can cause significant stress to relatives. And I've experienced that already twice. Okay? So it causes distress to relatives and friends. And as much as we can, this should be avoided. And you can search studies that had actually proven that psychological impact, stigmatization, and emotional shock happens when we go to an extent of doing such practices, especially the unnecessary wearing of PPEs. So I hope that at the end of this session, we will all be clear that PPE should not be worn by pallbearers. PPE is only worn when you're handling the body in the mortuary, and that's it. Okay. Next slide, Margaret. So the next session, Margaret, I hope that we're going to the next session, 5.4, is talking about autopsies. Yes, autopsies should be avoided as much as possible. This is why verbal autopsy is happening currently as we speak on death cases, on COVID deaths. So all cases that require postmortem should be dealt with on a case-by-case basis, and the decision should come from the consultants or head of the department that's referring or that's requesting for a postmortem. And Margaret has mentioned about this in her earlier slides. Okay, so if a body is suspected or confirmed 19 requires a postmortem, again, safety measures needs to be in place, and appropriate PPEs needs to be worn. So in this case, it's full PPEs, from eye shields to N95 masks, right down to to the foot covers. And we must remember that only a minimum number of staff should be allowed or should be involved in the postmortem. Okay? Now, after the postmortem, after the procedure, the body should be disinfected with sodium hypochlorite, and then the body can be placed in a body bag, okay? With the fear of, not with the fear, but with the risk of body fluids seeping out. So body bag, this is where we can use body bags. Okay? Again, once the body is in the body bag, the exterior of the body bag needs to be decontaminated with 1% sodium hypochlorite solution. And then the persons who are handling the deceased can then doff their PPEs. Next slide, Margaret. So the next subsession of 5.4 is talking about environmental cleaning and disinfection. I hope Margaret is listening. If we can go to the next slide, would be much appreciated. Okay. So we've talked about this. Again, this is a reminder to us that the mortuary needs to be cleaned at all times. It needs to be well ventilated at all times, adequate lighting, and the instruments that are used in the autopsy, instruments that should be cleaned.
Yeah, it's probably loading.
Okay, thank you, Margaret. I can see it now on the screen, and I hope everybody is on the same wavelength as I am. So like what I was saying, that in the mortuary, even the instruments that are used for autopsy, they should be cleaned and disinfected immediately after the autopsy. So that should be part of your termination procedures for the doctors or the pathologists who are doing the autopsies and the morgue attendant. And again, that's part of the termination procedures in autopsy. So I've talked about once the body is prepared, it's put in the body bag. The body bag is disinfected. So the table in which the autopsy was done or was conducted should be disinfected as well. First, Margaret, I think we've lost the slides. So we will continue on while Margaret tries to put up the slide again for us. Okay. We were talking about the procedures after postmortem. So once the body is kept in the body bag, okay, body bag is disinfected. So the table where the environmental surfaces really where postmortem was conducted should first be cleaned with soap and water or a commercially prepared detergent solution. And after cleaning, so it's a two-process cleaning. So after cleaning with soap and water, then a disinfectant with minimum concentration of 0.1% sodium hypochlorite or 70% ethanol should be used. So this should be placed on the surface for at least 1 minute. Remember, for the morgue attendants and for those who are working in, who are part of conducting the autopsies, okay, there should not be any spraying, water spraying done. Once it's wiped with soap and water, once it's cleaned with soap and water, you've sprayed the disinfectant or the 70% ethanol on the surfaces, leave it for a minute, and then you wipe those. So there's no water blasting or water spraying that would happen in the autopsy room. Once that is all done, then the morgue attendant, if he is doing the cleaning,
sorry, may you there? Just continue. Margaret's going to join again. She got disconnected.
of sanitizing your hands after removing each element of the PPE. And that's going to be the same for the morgue attendant or even for those conducting the autopsies when they doff their PPE. So at each removal of each element of PPE, sanitizing or hand sanitizing needs to be ensured. All right, now we'll go on to 5.6, and that's on the terminal cleaning on the place of death. Again, I will not touch that because Margaret has touched that already. Thank you, Margaret. Can we go back to the slide before this? Let me see if we've missed a slide or not. Okay, no, thanks. Sorry, next slide, Margaret. Thank you so much. Yeah. So for burials, we've actually taken this out from part of the SOP that was done by the team who are looking after the burial SOP. So we've actually combined that into this. So people who have died from COVID-19 can be either buried or cremated. Okay. So if it's the wishes of the deceased to be cremated, then we should respect the deceased wishes. And Margaret had emphasized on that. Now, it is important that during burials or cremation session ceremonies, we need to have health officials there. We do not need to have more than 5 or 6 like what we're seeing right now. 1 or 2 is enough, or even 1. Just having 1 health official or 2 there is important so that they would ensure that safety precautions is practiced at all times during the burial or cremation. So there's physical distancing measures applied or strictly adhered to. It's not only the attendees, but everyone who's there during the funeral. Again, 10 people, not more than 10, should be wearing masks. Okay? And all attendees at the funeral should have their Fiji Care app downloaded and all working. So the health officials should ensure that there are hand washing stations available at the funeral sites or even at the burial sites, or even the availability of alcohol-based hand rub or 70% alcohol-based hand rubs. Again, as I've mentioned before, and I'll say it again, that those who are tasked in, digging the graves and those who are the pallbearers, they do not need to wear full PPEs, okay? Regardless, whether it's the impervious gowns or the moon suits, some call them, or the coveralls, it is not necessary. Okay? And I would like to emphasize that because I see that's a practice that's currently being done, and I hope that we will discontinue that after the discussion of this SOP. And we just need to emphasize on hand sanitizing, because that's really the pillar of preventing infections at any time. Next slide, Margaret. We're coming close to the end of our sessions. Okay? So burial by family members or for deaths at home, the cleaning is the same as what's being done in isolation units for the cleaning of the deceased. Okay? So if mortuary services are not available, as what we are reading here, so traditional burial attendance can be done, but then those who are handling the deceased needs to be provided with full PPEs when they're preparing the body. Okay? I think one thing that we've forgotten to mention, and maybe this is a good time to mention this, for the deceased in the homes, when they are preparing the body, when you want to probably wear decent clothes for your deceased, for your loved one, okay? Before moving the body around, remember that even though your loved one is dead, you need to put on a mask on your loved one, okay? Or even a sheet to cover the mask, because there is still a possibility that there could be some air exhaled out during movement, and definitely that can pose a risk of exposure to those who are tending to the deceased when they're cleaning it. Okay, there is really no need for disinfecting the body, but just cleaning the body properly, wrapping the body or in a sheet, and having that prepared to be taken for safekeeping. But in villages, if there are no mortuaries, And, you know, we know in villages, in rural areas, they do burials on the same day, but we must adhere to the procedures or the protocols. Again, the police needs to be notified that there's a death in the family so that they could come and, you know, and certify with the doctor if it's available before you bury your loved one. Can we go to the next slide, please? Okay, so this is basically what we're talking about, a repetition of what we've said before, okay? So whatever is being done at the mortuary, it's going to be the same at home. Children, the aged, those with comorbidities should not come in contact with the deceased. Okay? And for those who are handling the deceased, once they've, you know, once they've cleaned the body, once they've wrapped their loved one, they should remove the clothes that they've been wearing. Again, it's a shower. They need to have a shower, a good shower, and, you know, go into clean clothes. I know that there's a practice in rural areas or in villages, you know, after they looked after the deceased, they still wear their clothes, the same clothes around, not with COVID. We need to remove those clothes, have it washed in warm water, and done into clean ones. Again, surgical masks should be worn at all times. Thank you. Next slide, Margaret. Okay, in terms of burial, I hope we have some health inspectors who are listening in these webinar sessions, and they could assist if there are questions around burial. So the normal process for applying and getting a burial order remains the same, irrespective of the COVID status of the deceased. Okay? So anyone who is COVID positive and under isolation or primary contact of the deceased, listen, must not be allowed to attend any funeral. Okay, if you are in quarantine or you're in isolation, your loved one has passed away, I'm sorry, you cannot attend the funeral. I know there's a lot of breaks to the rules, to this rule. You know, when your loved one dies, you know you're in quarantine, you know you're in isolation. Oh, it's all right. I can just wear my surgical mask and I go and attend the funeral. It's a big no-no here. So we need to adhere to the safety precautions. And again, when someone is given that document stating that you are in isolation and you break that rule, you can get into trouble. Okay. So this needs to be reminded to the community. And anyone who has COVID-like symptoms or even flu-like symptoms should not attend the funeral. Stay home. Okay? So even if it's just a recent cough, whatever it is, stay home, because there's a risk of you exposing yourself to others, especially when you're attending large gatherings as such. Okay? If the deceased needs to be buried or cremated outside of the red zone, so this is where our health inspectors come in as well. The family needs to ensure that you have a valid COVID pass, and this is obtained prior to removing the body from the morgue, including valid passes for any family member that will be accompanying the body. So any family member doesn't mean 3, 4, 5, 6 family members, okay? Probably just 1 or 2. Now the letter is conditional upon fulfilling quarantine requirements. Okay? So this is for families who would like to accompany their loved one across the border from a red zone to a green zone. And in the point there, again, IPC protocols need to be strictly followed. When we're talking about IPC here, we're talking about sanitizing, we're talking about the use of masks, we're talking about maintaining that 1.5 to 2 meters distance. Again, if a family member is calling, asking for PPEs because they would like to accompany or to transport their loved one across the border, please advise them that there's no need for PPEs. Recently, we've been getting calls from families requesting for PPEs because they're going to carry the casket across the border. It is not necessary. If you advise them accordingly that there's no risk of transmission from the deceased when it's in the casket, okay? So just sanitizing of hands is ideal. They should be satisfied with that advice. Next slide, Margaret. Now we're coming to the last part of our SOP. Again, in all SOPs that's being developed, there is a need to identify who's going to be responsible in ensuring that these SOPs is adhered to, is followed, and how everyone should be able to know and understand what the SOP is talking about. So I will not read that. We can read who are responsible there. And again, in terms of monitoring and reviewing this SOP, it's reviewed every 6 months, or if there are changes, there's always something new that we learn every day about COVID. So if we learn something new tomorrow about COVID in the care of disease, the SOP is going to be changed tomorrow. So, but if there's none, that there'll be a 6-monthly review of the SOP with the IMT, IPC pillar and the operations pillar, and those who were involved initially in the development of this SOP. Now, just for everyone's information this morning, it's ideal that we have a checklist in place. This is just to guide us. Margaret, if we're able to pull that up in the next slide, that'll be great. But otherwise, once you get access to this SOP, we have 2 annexes at the end of the SOP. One of it is the checklist, where it can guide you on what needs to be done from the handling of the deceased in the isolation unit to the mortuary and those who will be coming in to collect the body. Okay, so you have that as an annex in the SOP. It specifically spells out steps from point A to point Z on what needs to be done, and how we can guide our caregivers or our relatives, friends who comes to collect their loved ones at the mortuary. And Annex 2 of the SOP has the IPC cell. We acknowledge Margaret here on the development of a family information package. It's always good that we have something for the family when they're coming to collect their loved one. So this information package is a one-pager that, it starts off with, I would just like to read it to us. The first paragraph reads, "Our condolences to the passing of your loved one. This is a very difficult time to lose someone. It is our responsibility to support you, and together we can stop the spread of the virus. This information package provides special instructions to ensure that while we still continue with our traditional rituals in mourning the sad passing of our loved one, it is very important also to observe infection prevention and control measures to stop the spread of COVID-19. Okay? So that's part of what is in the information package. And colleagues, I tell you, not everyone that comes in from the community knows what IPC is. So the information package will guide them on the safety measures they need to adhere to when they come to collect their loved one, right to when they bury them. So thank you so much, colleagues. And I know we've taken your time this evening in going through this SOP. And I will hand the time over now to Dr. Alipate and the facility to close our webinar sessions. And if there are any questions, if they are providing time for questions, then we're happy to answer them if we can. Thank you, Dr. Pate.
Sarima, and thank you very much, Margaret Leong, for your presentation today. So the colleagues, I'm opening it up to the floor. Just raise your hand or feel free to put in a question in the chat forum. I've shared with you the actual SOP. It's further up on the chat. So if you want to download that, feel free to do that. And also the previous webinars that we've had, they're all online now with on the Ministry of Health and Medical Services website. And I've placed the link up there as well. So to the two presenters tonight, just a quick question. Just a question about whether there are any precautions or restrictions regarding cremation of a COVID positive body, or even to the scattering of ashes of a COVID positive body. Anyone want to answer that?
Sorry, Dr. Alipate, probably Margaret can assist in this, but I've tried to explore this in some researchers on, on the care of the ashes. Okay? But ideally, my understanding, okay, this is my personal view really, once the ashes, when the body goes into high heat, it goes into ashes, the virus dies at the same time. Okay. So I would say probably I can be corrected here by Margaret, or if somebody disagrees. Okay. So there is really no risk on the ashes of a COVID disease, or somebody who had passed away with COVID and has been cremated, because that has gone through high heat and it's just ashes there. So my opinion is there's really no risk. And I've tried to look through to see if there are studies on this. I haven't seen one. Maybe Margaret would like to add to that if I've missed out.
No, Sarema, all good. There
So
is
I
no
hope,
risk.
yeah. Thanks. I hope we've answered the question raised by Donette Lailai. Thank you.
Yeah, thank you very much.
Just to reiterate, following the procedures with the handling of the body is important, because this is where IPC is very important. Once the cremation process starts, then it's going through heat. It's going through intense heat and over a long period of time. So there should be no further problems. However, it's the cleaning, the environmental cleaning following the removal of the body, that's important, and that's been stressed throughout the SOP. Thank you.
Vinaka, sorry, one of the questions that was raised initially was with respect to open fires. So there's a crematorium in Davui level where the entire coffin goes in, and so there's little chance of any spread or contamination there. But the traditional cremations that are done where the body is actually removed from the coffin, would you have any insight into how this can be done safely? So the body is removed from the coffin and then placed on a wood fire altar, and then that's lit. So yeah, your insight on how they could make this procedure safer would be appreciated.
That's a really difficult one. Because ideally, because the disease is COVID positive, the body should not be removed from the casket. So in the event that this has to be done because of the tradition, then I'm afraid this is when full PPE needs to be worn. That's my take on that question. Sarima, you can add on. Over.
I have the same answer with Margaret. We've talked about once the casket is closed at the morgue for a COVID positive or suspected COVID death, we're not supposed to be opening the casket. But again, we've stressed in the SOP that we need to respect, traditions and rituals. So this is where it's important that we have our health personnel who's there to ensure that safety precautions is adhered to. And I totally agree with Margaret. This is where full PPE needs to be used, is necessary in terms of open fire cremation. Thank you, Dr. Pate. Again, sorry, and in addition to that, those who are involved in the open fire cremation, once they've completely handled the body, again, everyone still needs to keep their distance away. Probably, 1.5, 2 meters away, the usual distance that we've talked about. Thank you. And the other important thing is that, the healthcare personnel who's there to supervise needs to supervise those who are handling the deceased in the open fire crematorium, that they need to doff their PPE appropriately. So they need to be supervised, because the risk of exposure, if they do not doff appropriately on each element of the PPEs, and in between, ensuring that appropriate hand hygiene technique is followed. Thanks, Dr. Pate.
Okay, yeah, that was going to be our that was going to be my next question, just to make sure that they're doing that safely. Colleagues, anything else? Any other questions? So there's a question here. Maybe they should cremate the casket as well. Yeah, but I think there's a certain traditions and rituals where the body actually has to be removed from the casket itself. So I think that's the part that we're discussing.
Yeah, sorry, Sarima, and I brought it up, Margaret, sorry, because I actually live down from an actual open fire crematorium, which is why I asked, because we don't have medical personnel accompanying the families and the entourage of the funeral procession, nor do they have the means to burn a fire at sort of a high heat without having to remove the body, which is why I asked. And it's in a very windy place right on top of the hill up here in Vatwanga. So I was just wondering if you knew how maybe I could follow up just personally, if there's anyone I could speak to follow up and see whether that's being adhered to, because I live down the road, so I'm personally concerned.
Thank you, Donette, for bringing that up. This is something that we'll discuss also with our health inspectors who are part of the team in putting together the section on burial. That is a concern. Again, we need to confirm whether that was a COVID death or a non-COVID death. But again, to ensure that there's no questions hanging, we can come back to you on that. Thank you, Donette.
Does anybody else have any burning questions that they'd like to ask with regards to the safe management of a COVID-19 body, or even the funeral arrangements? Okay, thank you, colleagues. Again, we recognize that it's been a really long week for all of us. Thank you again for taking time to be part of this webinar. Once again, we will download this and we'll put it on YouTube, and the links will be shared on the Ministry of Health website. So the previous ones are all there. Feel free to access them. And on behalf of everyone tonight, I'd like to thank Sarima Vatuvatu and Mark Young for your time tonight. And yes, thanks everyone for joining. We will be in touch with all of you next week to give you the links to the next 3 webinars that are going to be presented. One of those days is definitely going to be Dr. Alisha Saud Khan, who's going to be presenting on RDTs. We were supposed to have that yesterday, but they're updating the SOPs, and we will be moving that on to next week. So stay tuned, as we will definitely share these links early next week. But otherwise, thank you very much, colleagues, for being on tonight. Have an awesome weekend. Stay safe until we meet again. Good night, and Vinaka Vakale.
Thank you, everyone.